Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering the antidepressant drugs. Now, this video is part 3 of depression. Make sure you go back and watch part 1 and part 2 if you haven't done so already. But in part 3, that is the beginning of the antidepressant drugs. Part 1 and 2, I actually went over depression, the nursing intervention, clinical manifestations, all that good stuff. But in this video, part 3, I start with the antidepressant drugs, and I start with the number one go-to first-line treatment drug choice for depression, which is our SSRIs. So I'm going to cover the SSRIs, and I'm also going to cover the TCAs. Now, in part 4, which is going to be the last part of the series, I'll cover the MAOIs. MAOIs are heavy, and it's very important to know. So that's going to be part 4, where I cover the MAOIs and alternate therapy for depression. However, before we get started in this video, guys, please, if you appreciate the content that I'm delivering to you at no cost, I'm asking you, please, guys, support my channel. Support my channel by either commenting on the video so you can help the algorithm, liking the video, sharing the video on your social media platform. You can go to my website and purchase an audio lesson. I have audio lessons on my website, nexusnursinginstitute.com. And also, almost every single day, you guys can watch me covering different types of questions on my other social media platforms, such as TikTok, Instagram, and Facebook. But I'm asking you guys, please, if you appreciate what I'm bringing to you, please support this channel. There's so many different ways you can support me, and I'm asking you to do so, guys. Thank you. All right, so let's get started. So with the antidepressant drugs, let's take a look. Let me make this a little bit bigger for you. Look at what it says. It says a drawback of antidepressant drugs is that improvement in mood may take 1 to 3 weeks or longer. That is very important. And guys, these are for the antidepressants across the board, whether we're talking about SSRIs, TCAs, MAOIs, it doesn't matter. It takes at least, at the minimum, 1 to 3 weeks at the minimum before the patient starts to feel better. And the reason it's so important to teach that patient that, remember, they're already depressed. Remember, depression is anxiety, anger, resentment, hostility turned towards who? Self. So if you do not tell the patient that at the minimum, it'll take 1 to 3 weeks before they start to feel better, after a week of taking the medication, they'll say, you know what? I knew I was a loser because everybody else can take this medication and they're getting better and I'm not. So you have to teach that to the patient. Look at this. If a patient is acutely suicidal, electroconvulsive therapy, which is discussed later in this chapter, I'm going to be talking to you guys about that in the next video, part 4, may be a reliable and effective alternative. Individuals experiencing their first depressive episode are maintained on antidepressants. Look at this, guys, for 6 to 9 months. For 6 to 9 months after symptoms of depression remit. Why? Because we want to make sure that those antidepressants remain in that patient's system so they don't go back into depression and it gets worse and God forbid they, okay? So let's talk about SSRIs, which are the first class of drugs that we go to for antidepressants. SSRIs, which are the selective serotonin reuptake inhibitors. SSRI antidepressant drugs have a relatively low side effect profile compared with the older antidepressants. And that's why we love them so much. They work very well without those adverse effects that we see in a lot of other antidepressant drugs. SSRIs are frequently, what does it say, guys? The first line treatment in depression. And you see, I put a star next to it. So you know, you better know it. You know, most likely if you're taking psych right now, that's going to be a test question in some kind of way. Okay. One rare and life-threatening event associated with SSRIs is serotonin syndrome. You need to know that. If you get a test question and they mention that the patient's on antidepressant SSRI, serotonin syndrome needs to be one of the first things going to the back of your head. You need to be thinking serotonin syndrome. You need to be thinking possible suicidal ideation, depending on the context of the situation provided to you. But the minute you see SSRIs, those things need to be already formulating in the back of your head. Look at this. It says the symptoms are many. And unfortunately, you have to know what those symptoms are. Why? Because you may get a test question and it doesn't tell you that the patient has serotonin syndrome. They just tell you that the patient has been on SSRIs for X amount of time and they're exhibiting, and they'll give you these signs and symptoms. You're expected to recognize that, okay, SSRIs, these signs and symptoms, I should be thinking of serotonin syndrome. And then they'll ask you what your nursing intervention is going to be or what's your priority going to be. But the point is, you're not going to know that unless you know serotonin syndrome and you can recognize it. So let's take a look. The symptoms are many: abdominal pain, diarrhea, sweating, fever, tachycardia, elevated blood pressure, altered mental state. That means their cognitive function is severely what? Decreased. Delirium. They're out of touch with reality if they're delirious, guys. Myoclonus, having muscle spasms. You see all of these? What did I write down here? Report right away. If a patient is taking an SSRI and you see these symptoms, you better call the healthcare provider immediately. You have to recognize that this is a medical emergency. Okay, this is an issue that needs to be resolved immediately. Let's take a look at this, the next page, which is a table. And up here, you see I wrote no with 3 exclamation marks because I promise you're going to see them as test questions. You better know them. They give you the SSRIs and all the drugs that fall under the SSRIs. Now, you guys better know all of them because I'm not your nursing instructor. I don't make your exams. But I can tell you, when it comes to NCLEX, HESI exit, ATI exit, these are the ones that come up the most. These two, the fluoxetine and the sertraline. However, like I said, guys, I don't write these exams, so you better know all of these drugs that fall under SSRIs, okay? The action of SSRIs, they block the synaptic reuptake of serotonin. Notes, what does it say again? First line treatment for major depression. Let's stop for a minute. When we just started reading about SSRIs, that was like the first or second line. That was the first or second thing that they told us. Why do you think the author took time to tell us that in the first or second line, and then now again on the very next page? Because it's important. Whenever you're reading, whenever you're studying, and you see the author repeating a piece of information, that means most likely you're going to see it somewhere on an exam. All right. So don't forget, it's a first line treatment for major depression. Let's look at the side effects: agitation, insomnia, headache, nausea, vomiting, sexual dysfunction. This is important. You have to warn the patient about it before they start this medication. And hyponatremia. That's important. Hyponatremia, sodium is supposed to be 135 to 145. So we're going to be keeping an eye on that sodium because we don't want it dropping lower than 135 in that patient having hyponatremia. Remember, most of your test questions are going to be based on ABCs, Maslow's hierarchy of needs, or ABCs, Maslow's, what's my third one? ADPI. ABCs, Maslow's, or ADPI. Guess what? Hyponatremia, that's electrolyte, that's sodium, that's part of Maslow's hierarchy of needs. Physiological integrity, fluid and electrolytes. So this is very important. That sodium being too low can severely injure, harm that patient. So let's keep going. What are the warnings? Discontinuation syndrome, dizziness, insomnia, nervousness, irritability, nausea, agitation may occur with abrupt withdrawal depending on half-life. Taper slowly. And guess what, guys? That taper slowly, that doesn't only go for SSRIs. That goes for psych meds across the board. You never discontinue abruptly. The patient has to be weaned off. Should never say never. There are very, very, very few situations where it's a medical emergency and you have to stop the patient immediately. But the rule of thumb is the patient needs to be weaned off of the medications. And those are psych medications across the board, not only SSRIs. All right. So make sure you guys know this. If you're in psych right now, you're going to see this again. Don't say Professor D didn't warn you. All right. Next page. Let's not get into that yet because I haven't touched on the TCAs. So let's get down here, serotonin syndrome. So wait a minute. Wait 1 minute. On the last page we were looking at, which was right here, the page before, they told us about serotonin syndrome. They gave us all these symptoms. And I wrote down here, report right away. This is very important for you to know, right? And then we skip over a page, and the author is giving us those symptoms again. Why? Because it's important. As a nursing student, you are going to see this again. All right. So let's look at it again. Hyperactivity at the start, the ones I put a star next to, those are the ones that you're most likely to get on a test. But remember, I don't write your exams, so make sure you know all of it. I'm just trying to, give you some hints. If you're someone like me where my brain only has so much capacity, so I try to prioritize. So if you're going to know anything, make sure you know the ones I put a star next to, but know all of it, but know the stars first, if that makes sense. So serotonin syndrome, signs and symptoms, hyperactivity, restlessness, tachycardia. Your heart rate's supposed to be 60 to 100, okay? That heart rate can go so high, that patient can go into cardiovascular shock. Fever, the temperature can be increased, can cause hyperpyrexia. Elevated blood pressure, that blood pressure can get so high, that patient can get a stroke. Altered mental status, mood swings, seizures. And guess what? Those seizures can turn into status epilepticus, which is a medical emergency. Myoclonus in coordination, tonic rigidity, where the muscles get just very, very rigid, right? Abdominal pain, diarrhea, bloating, apnea. That A means without, apnea is breathing. So not breathing can cause what? Death. So the ones you see I put a star next to and I underline them, you better know them more than all the others, but know everything. So we know the signs and symptoms of serotonin syndrome. We know when we see that a patient is on an SSRI, we need to be thinking of serotonin syndrome. So what are we going to do if we do see these signs and symptoms? Yes, we call a healthcare provider. What else? Let's look at these nursing interventions. And again, you better know, I put 3 exclamations next to it. Remove offending agent. Remember, I told you there's very few situations like it has to be an emergency for you to stop that medication abruptly, because when it comes to psych meds, the patient has to be weaned off. This is one of those situations. If the patient's experiencing serotonin syndrome, we don't wean them off. We stop abruptly. You don't give that next dose. And when you're scheduled to give that SSRI and you see the signs and symptoms and you suspect serotonin syndrome, you're going to hold that next dose and place a call to the healthcare provider. Remove what's offending them. Remove what's killing them. Initiate symptomatic treatment. So you're going to treat the symptoms. If it's a blood pressure that's high, the healthcare provider is going to order antihypertensive. If it's the temperature that's high, they're going to order antipyretic. If it's what else is going with the patient? If it's I'm trying to think, abdominal pain, they'll get an analgesic. Whatever it is that patient's feeling, that's what we're going to treat. That's what they mean when they say initiate symptomatic treatment. Whatever the symptom is, we're going to treat that. Cooling blankets, that's for the fever. Anticonvulsants, that's for the seizures. Induction of paralysis, that's for that myoclonus in coordination, the tonic rigidity. So just depending on what's going on with the patient, these are the nursing interventions that you're going to do. All right. Okay. I'm going back and forth, guys, because I want to do the SSRIs first before I move on to the TCA. So I'm back at this page because we were going over those signs and symptoms of serotonin syndrome, and I stopped at myoclonus and I went to the table. But let's come back here because they give you the rest of those signs and symptoms, which you also see here. Increased motor activity, irritability, hostility, mood change, severe manifestations. When you see that word severe, that a red flag should come up in your brain. Severe, that means this is something so bad that it can basically kill your patient. A patient can have a headache or they can have a severe headache. A patient that has a headache, they may not be on your priority list. You may see 3 or 4 other patients before you get to them. But a patient that has a severe headache, you're going running to them first. Because guess what? Maybe they have that headache because their blood pressure is so high and they're about to stroke out. So you see that word severe, that means priority to you, okay? Severe manifestations include hyperpyrexia, which is excessively high fever, cardiovascular shock, or death, all right? Okay, so now that we covered the SSRIs, let's move on to the TCAs. Those are our tricyclic antidepressants. Oh, I guess we're not going to move on to the the TCAs yet. I got another box for SSRIs. Let's go over this box. Lots of good things because I see a lot of stars, underline. So let's look at this. This says patient and family teaching for SSRIs. Teach. Look at the first thing. May cause sexual dysfunction or lack of sex drive. Inform nurse or primary care provider if this occurs. If you do not warn the patient that it can cause sexual dysfunction, and you let them know if this happens, all you have to do is let us know and we'll switch your medications. If you don't tell them that in advance and they get this, they're going to stop taking their med. And you know what can happen when a patient stops taking their psych medication abruptly. So you have to warn them and let them know that it's not a problem. If it happens, just let us know. We'll switch you to something else. We'll switch you to a TCA, whatever it is. But you have to teach them that in advance. Teach them. It may cause insomnia, anxiety, and nervousness. And again, if that happens, to make sure that they inform the nurse. SSRIs may interact with other medications. Tell primary care provider about other medications the patient's taking, including over-the-counter medications, vitamins, teas. You tell them anything that they're taking. It doesn't only have to be prescription. It can be over-the-counter. They need to let the healthcare provider know, including obviously medications like digoxin, warfarin. SSRI should not be taken, look at this, guys, within 14 days of the last dose of an MAOI. And you guys are going to learn why in part 4 when I tell you about the MAOIs. But the point is, we have to make sure that that MAOI is completely out of that patient's bloodstream before we start them on that SSRI, because there could be a major reaction that we don't want to see happen. No over-the-counter drugs should be taken without first notifying the healthcare provider. Common side effects of SSRIs: fatigue, nausea, diarrhea, dry mouth, dizziness, tremor, sexual dysfunction, or lack of sex drive. Because of the potential for drowsiness and dizziness, the patient should not drive or operate heavy machinery. We don't want them getting in an accident or injured. Alcohol should be avoided. You guys know that. When can you ever take alcohol with a medication? Never. Never. So you're going to teach them no alcohol. Liver and renal function tests should be performed and blood counts checked periodically. Here's the thing, guys. We need to make sure that liver is working. So we're going to be checking the ALT. We're going to be checking the AST. We're going to be checking those liver function tests, because if that liver is not working the way it's supposed to, it's not breaking down, metabolizing this drug the way that it's supposed to. So it's not getting rid of this drug the way it's supposed to. The patient can have a toxic level. Kidney function. We're looking at that BUN, we're looking at that creatinine, we're looking at that GFR. We need to make sure that the kidney's working the way it's supposed to, because if it's not, that means it's not going to excrete the drug that's supposed to. And so what's going to happen, that drug's going to build up in the body and the patient can have a toxic level, right? Medication should not be discontinued abruptly. Patient needs to be weaned off, except in very specific cases, such as serotonin syndrome, obviously. Look at this. Abrupt cessation can lead to serotonin withdrawal. Any of the following should be reported to the primary healthcare provider immediately. When you see that word immediately, pay attention. That means it's a priority for you. So what are you going to report to the healthcare provider immediately? Any increase in depression or suicidal thoughts? Because guess what? They might decide to take the entire bottle. Rash or hives, a rapid heartbeat, sore throat, difficulty urinating, malaise, fever, anorexia, weight loss, unusual bleeding, initiation of hyperactive behavior, and what kind of headache? Severe headache. These need to be reported to the healthcare provider immediately. Make sure you guys know that list. Common adverse reactions of the SSRIs: anticholinergic effects. You guys know that poem I taught you for anticholinergics. Can't see, can't spit, can't pee, can't see, blurred vision, can't spit, dry mouth because it dries you up. Can't see, can't spit, can't pee, difficulty urinating or urinary retention, and can't constipation, right? Anticholinergic actions are similar, such as the dry mouth, the blurred vision, the tachycardia, constipation, urinary retention, and esophageal reflux. They're usually not serious and they're often transitory, which means that the patient, when they first start the medication, they may experience it, but it's going to go away. Okay, so it's usually transitory. Look at this, guys. But urinary retention and severe constipation warrant immediate medical attention. Okay, weight gain is common as well. All right, let's talk about the TCAs. Let's switch gears now. TCAs. The tricyclic antidepressant TCAs inhibit the reuptake of norepinephrine and serotonin by the presynaptic neurons in the CNS and increases the amount of time that norepinephrine and serotonin, remember serotonin, guys, that's our feel-good neurotransmitter, our happy neurotransmitter, are available to the postsynaptic receptors. I want to show this to you guys. I'll talk to you guys about that in a second. No, let me talk to you guys about that now. I made a little mistake, guys, so let's back up. I'm sorry. Let's back up. These anticholinergic effects, because I don't remember, I think I told you these were the SSRI effects, but these are the TCAs. I don't remember what I told you, but just to clarify, in case I told you these were the SSRI side effects, these are the TCA side effects, the anticholinergics. Can't see, can't spit, can't pee, can't. All right, make sure, just in case I told you those were SSRIs, I was mistaken, it's TCAs. Okay, let's look at this box. Box 14.5, patient family teaching, tricyclic antidepressants. And guys, please forgive me. I'm making this video. It's 7:08 a.m. I've been up since 4 a.m. working. Then I did my makeup and I'm doing this video for you before I go finish what I got to do. So forgive me. All right. Patient family teaching, TCAs. The patient family should be told that mood elevation may take from 7 to 28 days. Look at this, guys. Up to 6 to 8 weeks can be required for the full effect to be reached for major depressive symptoms to subside. You have to teach them that. Otherwise, that thought that something's wrong with them will be reinforced. You have to let them know it's going to be a couple of weeks before you start to feel better. It's not something that's going to happen overnight. The patient should be reassured that drowsiness, dizziness, and hypotension usually subside after the first few weeks. And to be careful working around machines, driving cars, crossing the street because of that dizziness and drowsiness that can occur. So you teach them not to operate heavy machinery during the time that they're experiencing this, okay? As always, refrain from drinking. When can you ever have alcohol with medications? Never. You're going to teach the patient, if possible, the patient should take the full dose at bedtime to reduce the experience of the side effects during the day. Remember, this is a drug that's supposed to uplift your spirits, right? So does it make sense that, let me back up. This is a drug that's supposed to uplift your spirits, but the side effects of this medication, if you go back up, is what? Drowsiness, dizziness. During the day, most people have to do what? Go to work. You got to drive to go to work. A lot of people, the work that they do, they are operating heavy machinery. So the times that you would have those types of side effects, wouldn't it make sense to actually take that medication at night? So at night, I don't mind feeling drowsy. It will help me go to sleep. At night, I don't mind being dizzy because I know I'm not going to fall. I'm in the bed. It's better than if I'm up around in a crowded street where I could get hit by a car. Make sense? All right. Look at this. Suddenly stopping TCAs can cause, I don't know why I didn't highlight this because you guys have to know this. Nausea, altered heartbeats, nightmares. And when I tell you nightmares, guys, crazy type of nightmares that feel so real that the patient's scared to go back to sleep for days, okay? Nightmares and cold sweats in 2 to 4 days. We do not stop abruptly unless we absolutely have to. And then next is going to be the MAOI. So guys, the MAOIs and the alternate therapies is going to be part 4 of depression, and that's going to be the last video for the depression series. Again, guys, if you appreciate what I'm doing, please help me. Help me by either commenting to get that algorithm going, to get my channel on more pages on YouTube. Let me know what you thought about this video. Let me know what video you'd like to see me make. Don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com. And something I've been thinking about, let me know what you guys think. I'm thinking about doing a review, but live on YouTube, because the last 2 reviews that I did for you guys, I did it on Zoom and it would only allow 100 people in, and like literally within that first minute I already had 100 people, and I had so many comments of people that wanted to get in. So I'm thinking of doing a live review either next weekend or the weekend after, but I'm really trying to decide if I should do that live, if I should do a live review on YouTube, which I don't think I've ever done, so I gotta look to see how to do it. If I should do it on TikTok, or if I should do a review where I'm doing it like this, I just recorded and you guys watch later, because I'm not sure with the lives on YouTube, is it still taped that I could post later? And the reason I wanted to do the live, so that after I do that review, I can answer questions that you guys have. Let me know what you think about that, if that's something that you would be interested in. Thank you so much for watching this video, guys. Don't forget, you guys can catch me on my other social media platforms such as TikTok, Instagram, and Facebook. And every Sunday at 1 p.m. Eastern Standard Time, I have a new video that's released where I cover questions. Thank you so much for watching this video, and you guys will catch me on the next video.